let's get to something that will address the state of health, but I want to look at it through your perspective and experience. And you tweeted once, and I think it's pinned, actually it's pinned on your profile. You get your A's in high school, you decide you want to be the cliche neurosurgeon, you study medicine for 6 to 7 years as an undergraduate, factoring in doctor strikes, lectures strikes, pandemics, etc. You finish, alas, you're hopefully posted as an intern for 1 year, and then you go through a thread after working 6 months without pay as an intern. You now become a licensed medical officer. You are now board certified and can practice as medical officer after 8 years of training. You gain 2 years or more of work experience and decide to specialize. And when you apply for specialist training in the same institution, e.g. University of Nairobi, that trained you in the undergraduate level, you passed a gruesome exam and told school fees is 600K a year, and you will be attached and work or train at the largest referral hospital in sub-Saharan Africa. You're told you are now a student, and despite being a board-certified medical officer, you will offer free services at KNH in the name of learning. Yet, all the patients are billed and the hospital makes revenue. You are hopefully trained under supervision. Now, this is something you posted October 2022. What message were you putting across?
So, October 2022, I had just cleared. I just finished my master's program.
Yeah.
And what we were fighting then, even in 2021, 2022, was they had tripled the fees to become a specialist. We don't have many specialists in this country. We already have a shortage of doctors.
Yes.
We have very, very minimal specialists.
Because of brain drain?
Because of brain drain, yes. Also because at that point we didn't have the institutions. You had to go to study outside and things like that.
Right.
Before, the government used to be courteous enough or clever enough where if you need to go and train, the government will sort you out and things like that. But now you're on your own. Devolution happened. Unless your county is going to sort you out and pay for your fees, it's not going to happen. So a lot of us, like myself, I was self-sponsored.
Right.
So what I saw was that even the guys that government was supposed to sort them out, the national government was supposed to pay their fees, we're supposed to sit for exams, and then you're being told that your fees is pending. You have 1.2 million that you need to pay, otherwise you're not sitting for your final exam, despite putting in the work for the past how many years, submitting a thesis, all that stuff.
Right.
But you're not going to sit the exam because Gava hasn't paid your fees, and the fees has gone up, and they've refused to pay, and we're at a stalemate. University won't allow it.
Yeah.
So this is actually, it's actually good that was the pinned tweet you read, because that was some of the activism that I switched up on, where I use social media to kind of inform. Because behind the scenes with the union pushing, of course, we didn't just put it on social media, we had to picket.
Yeah.
We had to go to Afe House, the usual things that you see on TV, have a bit of tear gas, some people got a bit of tear gas, but the whole message was you can't increase the fees 3 times up. We're going to have less specialists. We're going to have poorer quality of healthcare, especially in the tertiary hospitals, your level 6 hospitals, that you need this kind of care.
Yeah.
So yeah, this is some of the stuff we did. I'm happy that to say, and as much as that is pinned now, I need to change it. I'm happy to say that the fees won't be increased. It's no longer going to be 640, because this was not only for postgraduate, this was also for guys who are doing med school.
Yeah.
So you're going to spend millions becoming a doctor. And remember, we have 4,000 unemployed doctors right now, young guys who are unemployed, who have put in the work 7 years plus, who have gone through that PTSD of medical training that is really the worst.
PTSD, you say?
Yeah, proper PTSD. Medical training, and it's not in Kenya, it's global.
Right.
The way you learn medicine is gruesome. It does something, it takes a toll. You're always expected to have excellence.
Yeah.
Remember, you're going to be in charge of human bodies. And we're also in a world where you're just waiting for somebody to make an error and you say it's your fault.
Yeah.
So you always have that stress. Some of it is not the best. I mean, I've seen it in University of Nairobi. We can have some of the harshest, teachers and things like that.
Yeah.
That's their way of maybe trying to make us better.
But since that pinned tweet in October of 2022, things have changed in terms of the fees that you'd
Yes.
have to pay. What
Yes.
has changed?
So the union, after a lot of lobbying, the union
Yeah.
and the University of Nairobi, the vice chancellor revisited it. It actually went to court. First, a court order was issued where the university was not supposed to raise the fees, but they ignored it, so they kept pushing, and now it's come down. So now they just have to, you pay 340 for the first year and then 300 flat for the rest, which is okay because it was originally around 240 something, 250.
Yeah.
So given inflation and things like that's fine. But you can't switch from 240 to 650
Yeah.
overnight and expect, because you guys have mismanaged, because universities also have not been managing their funds
Right.
properly. So it was, I think that was a big win. I'm proud that I was involved
In that.
In that. From the university level, getting residents together to speak out, not being afraid. Because the thing is, people get afraid to speak.
Right.
Because if you speak out, then you're not getting your masters. You're speaking out against the same guys who are going to give you a master's degree. So a lot of people don't want to. They'll be like, okay, let me just pay this money, get my degree, and get the hell out of here. But who's going to suffer? It's the next generation.
You go through the PTSD of the training, you manage, and congratulations. I saw you celebrated along Mombasa Road. Thank you for inviting me. I wasn't invited, I'm playing. But you were celebrating at the same time with your sister because she was also graduating, and that's a big achievement. So hats off to you guys through the difficulty. But then you would almost expect that a plum job is awaiting you. What was waiting you?
Man, it's crazy. So once you finish Masters of Medicine, and you're self-sponsored, if the county has paid for you, you get bonded. So you go back to the county and you serve as, as an obs-gyn, as a ped, as a surgeon. But when you're self-sponsored, you kind of have to fend for yourself. And there's also something we call a specialist recognition. So that's what I was pointing to, where you've satisfied the board of examiners and everything. You have been practicing. All these people are practicing at the Kenyatta or Eldoret Hospital, Moi Teaching Referral Hospital, in the position of a surgeon under the supervision. But you're told for another 2 years you're going to be observed. But in reality, what it is that in those 2 years, you're not going to be making the money of a specialist. We will still keep supervising you as, what do they call it? As a senior registrar. So you're called a senior registrar. So you're a senior registrar, meaning that you can't call yourself a consultant.
Right.
It really limits you in whether you can admit or see to patients in different hospitals and things like that, because you need another license from the medical council. So right now I'm in that limbo period of specialist recognition, but
there was a time you worked at county level, Lamu.
Yes.
And how was that? Because people felt the devolution of the health function is is going to be great for the country, taking it closer to the people, but it doesn't seem to be as great for you, the practitioners.
Yeah, and that's failure on us as doctors, because and citizens. This is why public participation is so important.
Right.
I keep telling Kenyans, like, as much as sometimes, and when you say activism, sometimes I had to take a step back from always being the guy who you expect to speak out about something. Financial bill, you expect me to say something. Or NHIF is doing this now. They've said they're not remitting funds. You're waiting for somebody to speak for you. You're not participating in these public meetings. You're not going to parliament to these meetings. That's exactly what happened. Doctors have this God complex. Healthcare workers have this God complex that everything will revolve around them, and it doesn't matter, because healthcare is one of those things that nothing bad can ever happen to healthcare, or we can never lose work in the health field. So health got devolved because nobody showed up to public, participate. There
Right.
wasn't even a doctors' union then at that particular time. The doctors' union is a relatively new thing. So number one is that people just need to participate in all of that stuff. But activism, I wouldn't. I would take a step back, because people need to learn how to start asking their own questions and,
Right.
and demanding for better. And you don't have to go Mandamano Monday, Thursdays. No, you can decide that every public participation meeting we're going to be
You're
there.
going to be there.
That's your Mandamano. You don't have to go to the streets. Use the legislative ways. And then if we're not getting headway, then we can start talking about, let's go and, protest, because clearly we're participating, but nothing is being taken into
You've
account.
mentioned Mandamano, and a layman would say the instances where they see the doctors, the fraternity, just down their tools and people are dying, is heartless. Hamna roho, hamna utu. Where's the code? What do you say to that?
When you see doctors die by suicide because they believed, you always see it. Somebody graduates from secondary school and they're A and they're top, and you're showering them and you're pumping this person, psyching them up because they've done so well. They worked very hard. And the first thing they say, they want to be a neurosurgeon, they want to be a doctor. So they do that. They get into medical school. They work extra hard.
Yeah.
They get there, all the other people there are on their level. They're not special anymore, because those are other A students, B students. So everyone is smart. And then the teachers are making you feel like you're just like everybody else. So you've lost that. So you go through that PTSD. And then you get unemployed. First of all, to get into internship nowadays is like, winning a lottery. People have to bribe to become interns. Wow. People are literally bribing from Mafia House, which is the Ministry of Health,
Yeah.
and other places, so that they can actually get an internship slot. Because there's 4,000 unemployed doctors. Devolution is no longer about you, where the national government sees the need and they post you. Before, it used to be what we used to call automatic posting.
Yeah.
You finish out of med school, you go for internship. You report to Mafia House, and they tell you, we have 2 doctors in Turkana, we have one here, one here, one here. Please pick your spot, or you ballot or write, and you go wherever. But at least there's a doctor going. Every single year people graduate, there's a doctor going somewhere around this country to serve Kenyans. Nowadays, it's not like that. Nowadays, it's a county public service board.
Okay.
Maybe the county says, I feel like I'm very well staffed with my 6 or 10 doctors. We don't need any more doctors. So we're not going to issue any adverts for doctor. So now you're stuck, because you have to apply now for a job. Medical internship is gruesome. You go 5-6 months without any salary. Right now, as we speak, just the other day, interns were on strike. They hadn't been paid for 5 months. They picketed at Mafia House, and they eventually came out. The CS told them, okay, we're paying you, but they paid 1 month, yet they have a debt of 4 months.
Right.
People have to pay debts. People have taken loans. People are not well off. Some people are not well off at all. So when you say hatuna utu, and you guys, how can you let people? You need also to think about these healthcare workers, and not just doctors. We're talking nurses, we're talking clinical officers, lab technologists, pharmacists.
Yes.
Everyone in the healthcare docket. They're not. If you can't sort out their needs, their basics, housing, food, transport, and things like that, how do you expect this person to deliver health services to you? And what quality of health services will you get from somebody who maybe hasn't been paid in the past 3 months, or whatever they're being paid is peanuts by the time pay as you earn? Now financial bill is coming, housing bill, whatnot, all these taxes. Then you have your loans because you have kids.
Someone might say you knew what you were signing up for.
Not necessarily.
Right.
Because I would say that a lot of us are naive, and that's why I'm saying people are not speaking out. When this person is in high school screaming and they want to be a neurosurgeon, people are not telling you, no, 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 don't pursue medicine. People are telling you, be a doctor, because doctors are well off. We see them driving the big cars and things like that, and,
Yes.
and all that stuff. That is the perception you have. And I'm not saying that the medical field, if you do it well, is not something that
Will pay off.
will pay off. It does. It's just that people need to understand that the dynamics are changing.
Right.
It's not just healthcare. There are teachers out there who are unemployed.
Yeah.
There's so many people who have degrees, master's degrees, who are not even in the field that they studied to be.
Yes.
So for me, it's not about, people should look at it, healthcare worker is a professional, just like you go into a bank, to a
Yeah.
bank teller,
Yes.
just like you go to anywhere else, it's the same profession. So pay a professional, get professional services.
Does that explain then, because there's the other perception about the doctor fraternity that you guys almost, it's like we're paying back for what you went through, all those years of PTSD training and the hard conditions, that when you set up your practice, you bill us so high. But it's just because we're desperate and we need the treatment that we just have to pay you for consultancy, several thousands for a few minutes of you looking at me, asking me my quick history, and writing quick prescription, and then out, and you have your thousands. Just explain to a layman who sees it from that perspective.
So I put it this way. Count the years just count from high school. Because you have to be a special kid in high school to end up in medical school. So you already started hard. But let's just count from medical school,
Yeah.
internship, and working as a medical officer, going back to training to become a specialist, getting specialist recognition. Now, if you're a neurosurgeon, you're looking at 16 years. 16 years of somebody's life, almost 20. That's almost half your life. And this is 16 years from the time you're probably 18 years old. Yeah? Ask yourself from the time you turned 18 to 19, what could you have done in 16 years if it wasn't you dedicating it to this profession? So in those 16 years, all my experience and learning and training, I can do that surgery on your brain for 3, 4, 5 hours and charge you how you should be charged. Because it took that person 16 years to come back and do, or 14 years, to do a cesarean section in 1 hour. Baby's out, safe, you're doing well, but they've done it in 1 hour. Because you see, you look at it like, okay, the doctor has come, he's taken 15 minutes of the time with me, he's given me the prescription, because that's what I've been doing.
Right.
That's what I've been doing I've dedicated a block of my life just into that. So you look at it as decades of training, and I'm able to come to a conclusion in a few minutes. I'm able to do a surgery in a few hours because of that. And honestly speaking, if we look at the board rates, the medical board rates for consultation, we are actually not charging what we're supposed to be charging. Because if I look at the economy now, even the Mwananchi won't be able to afford it.
Right.
But if I look at it on an insurance standpoint, I find that there's a lot of fraud and corruption that is going on there deliberately to make sure that our consultations are low. People don't look at our return on investment because healthcare is seen as they like to put it in the Hippocratic Oath, it's seen as it's a calling.
Yeah.
A calling doesn't pay your bills. Calling won't pay my son's school fees. A calling won't pay my loan. So it's a profession like anything else.
Right.
You go see a lawyer and he'll bill you per hour. He'll bill you per hour.
Right.
But that's because he's dedicated all his life into this.